You randomly pick a pain medicine hoping that it works. You wait and wait but are still suffering from pain. You're like, uh-oh, did I take the correct medicine? You're not sure if this will work or not. In this video, I'll tell you which pain medicine works best for your situation, how to take, how much to take, and when to take. I'll also help you make the right choice so you save money by picking the right type of medicine. Keep watching. Anybody can have pain anytime. This is so unpredictable. Many people, when they have pain, they do not want to take medicines. But there is nothing wrong with that. This is because of the thinking of why take unnecessary medicines. Some may use pain bombs. Some of you may take coffee or tea or soda or whatever it is to get relief from pain. Even others may take a warm cloth or compress and just put it where they have pain. But these all do work to some degree. At some point, the pain gets severe or you want more immediate relief and you're looking for pain medicines. Now you decide to go to a pharmacy to buy something, or you may have some stock at home. Either way, it can be so confusing. Now here is a question for you. What do you do when you have pain? Do you use medicines or prefer not taking any medicines? Comment below. Here we are talking about pain medicines that you can buy without a prescription. It does not matter how the medicine looks. You can consider the medicines into three big categories. This is important to understand. Number one is paracetamol, and this is also known as acetaminophen in USA and Canada. Number two is NSAIDs, and this is commonly pronounced as NSAIDs, like ibuprofen or aspirin. Now ibuprofen is commonly sold as Brufen, Ibugesic, Advil, Motrin, and so many different names. The last one is natural things, and here we use the example of turmeric or haldi. Now here is what works for your situation. Let's see when you should take paracetamol or acetaminophen. Now first important thing to understand is that paracetamol affects only pain and not inflammation. But you'll see the importance of this when I speak about NSAIDs. What this means is that you take paracetamol when you have fever or general body pain that can occur when you have a viral infection or flu or even COVID. Now this medicine enters places in the body where you have pain and they stop sending out pain signals to the brain so you don't feel any pain. Question to you, did you know this is what paracetamol does? Comment below yes or no. Paracetamol is also a medicine that can be taken by pregnant women. As pregnant women have so many restrictions in terms of what medicines they can take, since the medicines they can take can affect the baby inside the women. The next thing is NSAIDs like ibuprofen. If you have pain because you fell down, or let's say you have a sprain, or you unfortunately fell down, have a fracture, or any such thing, then ibuprofen is the drug you want to take. If you cannot find ibuprofen where you live, you may be able to find medicines like naproxen or celecoxib, but it's kind of the same thing. All these medicines belong to a class called NSAIDs. The NSAIDs are also good for other types of pain, like let's say you have a headache, menstrual pain, back pain, joint pain, tooth pain. This is helpful for all these kinds of pain. Ibuprofen blocks a substance called prostaglandin that increases pain and inflammation, and because of this blockage, you get benefit from pain. Now let's talk about aspirin. Although aspirin is an NSAID, this is not used for pain relief, so do not choose this medicine if you have pain. Aspirin is not that effective and requires high doses, which can increase other side effects like stomach ulcer and bleeding in the stomach. The main reason aspirin is used today is to reduce the risk of blood clots when it is taken in a low dose of 75 milligrams or 81 milligrams. Here is a pro tip. If you think someone is having a heart attack, you can give, or rather you should give, 4 of those small low-dose aspirin, also called baby aspirin, while you're waiting for help. They can be crushed and chewed like a chocolate. This is because they work the fastest when they're chewed based on scientific studies. If you found any value with this video, make sure to hit that like button so YouTube knows this is a video that is providing value to viewers and also helps me. When it comes to natural supplements like turmeric or haldi, which is used almost every day in India and other Asian countries, this has been scientifically tested in arthritis like osteoarthritis, which is actually pain in the joints due to age. If you don't have this at home, it may be difficult to find these tablets. Where will you go looking for this tablet when you have pain? So for the purpose of commonly occurring pain like I'm mentioning in this video, you're better off just taking paracetamol or ibuprofen. What I personally do is I keep a stock of paracetamol and ibuprofen at home, so when I have pain, I don't go looking for the tablets. Now here are some tips to make sure you take these medicines safely and not have any side effects. Paracetamol comes as 325 milligrams, 650 milligrams or 500 milligram tablets depending on what country you live in. How much medicine should you take? I have left the doses in the description below so you can refer to them whenever you want it. These doses are for grown-ups and don't give them for children. Do not take more than 1000 milligram at any given time, and the maximum you can take is 4000 milligram every day over 24 hours. So if you're taking 500 milligram tablets, you can take only 8 of those tablets. And if you take 650 milligram tablets, you can take up to 6 of those tablets. But this is over 24 hours, not during the day, but over 24 hours. Keep that in mind. If you take more, you can end up in trouble. It can cause liver failure, which unfortunately affects many people who end up in the hospital. When it comes to ibuprofen, the maximum dose is 800 milligram every 8 hours. Well, you can usually start with a small dose of 200 milligram or 400 milligram at a time for, let's say, a body ache or a headache, and you can always increase this if you need to. Taking more of this medicine can cause stomach ulcers and acid reflux, which can lead to burning sensation behind the throat. So a tip for you to take this medicine or any NSAID is to take it after a meal so the stomach irritation will be less. If you're this far into the video, this means you're serious about pain. Now I want to mention some special situations which you can find beneficial. The first situation is using these pain medicines for alcohol hangover. If you drink alcohol, do not take any paracetamol or ibuprofen in the night to prevent a hangover. This is not good. The liver will already be overworked with alcohol, and if you take paracetamol on top of that, the liver will be put to strain, and this is not good. Alcohol also causes dehydration, and you may have experienced this if you have the habit of drinking. Dehydration reduces urine flow, blood flow into the kidneys. So these drugs are not good either for the liver nor for the kidney. Also, if you have the habit of drinking alcohol, make sure you eat food along with it to prevent any excessive strain on the liver. I can't tell you how many times people just drink and skip eating anything and then unfortunately end up having all kinds of liver problems. The next situation is when you have pain with exercise. Well, if you exercise, you may sometimes get pain. Taking paracetamol or ibuprofen generally does not help. Also, the inflammation that occurs with exercise, unless you have an injury, is a healthy one, and it actually helps heal the sore muscles. Taking coffee, in fact, is found to help with exercise-related muscle soreness. Just try it out. That is what I do. The next situation is when you have surgery. If you have severe pain like after surgery or other reasons, you can also take paracetamol and ibuprofen together. You can time them in such a way that you take paracetamol and take ibuprofen after a few hours and keep repeating it. Of course, keep in mind the maximum dose. We follow this strategy routinely in the hospital when treating patients. Now, it is important to time the medicine correctly if you need to get the benefit out of it. If you know you're going to have pain, some of the examples are menstrual cramps or migraine, take it before it starts. After all, prevention is better than cure. Most of the times you cannot predict when pain starts, in which case you just take as soon as feasible. Thank you for watching. Do check this video by clicking this link on how to clean your liver and take good care of it, because everyone is at risk for liver problems. If you have any questions, post in the comment section below and I will try to get to you as soon as possible. If you like this type of health related content, make sure to hit that subscribe and like button. Take care, stay safe, and I'll talk to you soon. From today on, I'm going to start this new challenge where I ask you a question and you have to answer in the comment section below. The people who get it correct, I'll mention you in my next video. So today's question is, what is a good pain medicine to use for tooth pain?